July is National Minority Mental Health Awareness Month. You may ask, why do we need a Minority Mental Health Awareness Month? Isn't there already a month for mental health awareness? I'm glad you asked. According to the U.S. Office of Mental Health, the reason there is a whole separate month is to bring awareness to the unique struggles that racial and ethnic minority communities face regarding mental illness in the United States. Mental health includes our emotional, psychological, and social well being. It affects how we think, feel, and act, and helps determine how we handle stress, relate to others, and make choices. Racial and ethnic minorities often suffer from poor mental health outcomes due to multiple factors, including lack of access to quality mental health care services, cultural stigma surrounding mental health care, discrimination, and overall lack of awareness about mental health. In previous episodes, I discussed social determinants of health that affect our ability to have access to quality care. It is more of a problem when it comes to mental health care than physical health care. Many people of color, whether we speak of African Americans, Asian Americans, or indigenous peoples, often subscribe to cultural, societal, or spiritual norms that are not conducive to seeking mental health treatment. We are often taught that we only need to pray or have more faith. While many will take medication for high blood pressure or diabetes, they draw the line at medication that deals with the mind. Lack of information regarding mental health is not only found in our communities, though. Historically, mental health was regarded as being a totally separate issue from physical health. Often, you would be treated for one or the other, but not necessarily both. While our culture, by and large, has normalized seeking treatment for aches and pains, we tend not to seek help for things that affect our emotions and thought processes. Our communities must normalize behavioral and mental health as well. The mental health system in North Carolina has a history of not being too good across the board. But like many things, attention was drawn to the need for more comprehensive mental health care and more availability in all communities, but particularly in marginalized and underserved communities during the pandemic. In the Roanoke Valley, agencies such as Trillium, Integrated Family Services, and Monarch, to name a few, are now working to bring mental health services to the community. There are mobile crisis units, telehealth services, and even text crisis lines to allow people to begin the conversation anonymously if they don't feel comfortable letting anyone know they're seeking help. The National Suicide Hotline is now a 3-digit number, 988, to make it easier to remember. Suicide is one of the leading causes of death in the United States. I am Daly-Mack, RN, and I want you to remember that physical health matters, mental health matters, and most of all, Black health matters.